Now, the Western Cape Liquor Licensing Tribunal has refused a Sea Point petrol station a liquor license. Residents of Sea Point, Fresnay and Bantry Bay have lobbied against a liquor license application for a Pick and Pay Express convenience store at the BP garage in Regent Road. To discuss, we're joined by the Director of South Africans Against Drunk Driving, that's Caro Smit. Ms. Smit, you say you're happy this will discourage other petrol stations from applying for liquor licenses. In the first place, is liquor being sold at any petrol station in South Africa right now?
Good evening. Excuse the lighting.
No problem.
We have load shedding. Yes, it's being sold in Gauteng at the moment, but we as a group, South Africans Against Drunk Driving, as well as Southern African Alcohol Policy and the Medical Research Council and various other people, just said we have too many alcohol outlets in South Africa already. We have so much alcohol-related harm, as we saw at the various taverns with underage patrons dying or people being shot. And we just felt that petrol stations should not be allowed to sell alcohol. So that is why we all got together with the people, and we appealed to the Western Cape Liquor Board and just said we really felt it was a very bad idea. And in fact, they have turned down the applications turned down 9 applications, and 3 are in review. So we are thrilled with that judgment.
So different provinces right now are making different decisions, but it could go through the courts. Do you believe ultimately you will be victorious, so it won't be sold, or could this be challenged? Could we even have a national solution eventually?
It may be challenged, but I think in light of the alcohol abuse in South Africa, that we are really seeing what's happening. We have the research now to support how much harm is being done. You know, from the research that was done by Medical Research Council in the hospitals during COVID, when alcohol was not allowed to be sold. I don't think people, if they do challenge it, I really don't think the Western Cape will approve it. I don't think the other provinces will approve it, because it's just a very bad thing to try and associate alcohol with driving and selling it in a so-called convenience station. We have too many other outlets all over the place. And we also don't want to tempt youngsters, say youngsters who have just got their license, who may have a lot of other young people in the vehicle with them, to sort of pop into the convenience store and at the petrol station and sneak, buy alcohol, and then the other young people drink it in the car and the driver drinks it. Because if you look at the deaths of young people between the age of 15 and 29, the leading cause of death are car crashes. And if we look at alcohol being behind the deaths on our roads, it's at about 58%. So we're really needing to go more with the World Health Organization's recommendation that alcohol is not sold in petrol stations, that we stop alcohol advertising, that we bring the drinking age up to 21.
Sure, but haven't you touched on one of the contentious points when you said that there are many outlets? I mean, residents have said this will be close to a school, old age care, religious facilities. But we have so many outlets, so many retailers with liquor licenses. So if you're not buying it at the garage, you can just go around the corner, buy a bottle of wine and put it in your car. What's the difference? It's not that you're going to necessarily start drinking it when you get into your car.
Maybe you and I won't, but a lot of people will. And that is the problem. There's that, unfortunately, what we're seeing more and more people drinking and driving. I see people driving along very happily drinking out of a alcohol bottle. There is just not enough enforcement being done. There is not enough shame being felt by the people who drink then drive. People think it's a right to drink then drive. They're not seeing the pain of the deaths that they're causing to the victims. On Wednesday, I was in court with a family who, in fact, 4 young men had been killed. They were changing a tire in Soweto on the side of the road, and a man who only drinks once a month, he said, he felt that wasn't too bad, but killed all 4 of them and injured someone else. And we're seeing this over and over again. So yes, people can go to other outlets, but that in itself, we have too many outlets, and these are all the things that the government is actually looking at or need to look at. We need to close down the density of the taverns, of the shebeens, of the alcohol sales. We need to have more education, more enforcement. We need people, the 31% who drink, or in fact the 69% who don't drink in South Africa, to stand up and get incensed about this big problem alcohol is causing.
Ms. Caro, I understand what you're saying. Alcohol abuse is a real problem in South Africa, but we're talking about a solution here. Is the solution to bar garages from selling, to make it less readily available? Even the research you brought up, if I remember that research correctly, it said that reducing sales of alcohol didn't seem to make much of a difference. Only an outright ban for a period of time made a difference. So I'm questioning the solution, not whether or not there's a problem.
Okay. Yeah. Reducing the hours of sale is definitely one of the solutions, as discussed by WHO. So reducing the time certainly does, raising the price does. But the other thing is, if you look at how many South Africans are lawless, and you look at people who sell things under the counter, there is much more chance of alcohol being sold under the counter for 24 hours, if the convenience stores are open for 24 hours. So we're just putting temptation in too many people's hands, and we need to all work on bringing down alcohol abuse in the country. And this is one of the methods.
All right, thank you. That was the Director of South Africans Against Drunk Driving, Caro